Hi, everyone. Thank you for joining us for a research brief titled Addressing Resource Gaps for Alcohol Use Disorder Among Punjabi Folk Through Community-Informed Initiatives. This project was undertaken by myself, Babanjeet, a fourth-year medical student at UBC, as well as Dr. Natasha Puri, who is a family physician with an addictions fellowship working in Phaser Health. So, during this presentation, we have three objectives. The first is to identify and describe challenges faced by Punjabi patients when seeking treatment for alcohol use disorder. Secondly, to understand the role of tailoring alcohol use disorder treatment for a specific racialized community. And thirdly, conceptualizing how to practically implement community needs to address gaps in resources. For those of you who don't know, as a background, although data and literature is quite sparse and early, there are early signals that show people of Punjabi ancestry who are living in North America with alcohol use disorder suffer most from underutilization of services, despite there being services out there. And this is also in the picture of having significant associated morbidity and mortality. More tellingly than the literature is clinical experiences in the lower BC's lower mainland. So there are repetitive ER visits by patients who have severe and complicated withdrawal, including seizures, deliriums, tremens, alcoholic pancreatitis, and end-stage liver disease. And in the outpatient setting, you can see that Punjabi folk drink up to 375 milliliters of hard liquor a day and have significant binge use and other concurrent substance use. In particular, a study was done in the UK, and it showed that Sikh Punjabi men consume greater amounts of alcohol and suffer more alcohol-related disease when compared to other South Asian and Caucasian men. We hope to also understand this in the lower mainland at some point. We know from generalized studies of racialized populations that there are many barriers to access healthcare, with some of the main ones being a lack of awareness regarding resources and supports. Yet, we also know from a pocket of studies on approaching treatment for racialized groups that there's a significant benefit from adopting language-specific materials and support groups and having providers who understand cultural nuances for specific patients. Knowing all of this background, what we wanted to do was develop a resource that could address these barriers and gaps in the Punjabi community so that we could create a resource for them. To understand our particular context, we completed a needs assessment, and specifically in this needs assessment, we are trying to identify what are the barriers to access, what supports are needed in this community, and how to practically make it available to that community. In order to understand this and answer these questions, we did a community needs assessment. So firstly, we created a online questionnaire that was tailored to address the objectives of the needs assessment, focusing on barriers, community needs, and methods of dissemination. It was created by myself and Dr. Natasha Puri, as well as reviewed by two members of the community. The questionnaire was then translated into Punjabi to increase the ability of the community to respond. And then finally, it was presented firstly as an online anonymous survey administered through Qualtrics, which is a encrypted survey platform. And that was distributed on social media platforms that are directed to the Punjabi community, whether that included Facebook accounts, Instagram accounts. And then secondly, we also had an anonymous paper copy survey that was administered at a local medical clinic that is specific to Punjabi folk struggling with alcohol use disorder. After this survey was administered in the community, the results were collated and analyzed by Qualtrics for quantitative values, and then qualitative themes were pulled from their survey responses by two different research assistants. So what we found was we had 81 responses in total, and these were from both family members of people struggling with alcohol, as well as somebody who was struggling with alcohol themselves, but a lot of them was family. The most popular age of response was between 20 to 30 years, and then there's a similar amount of people between the age of 15 and 20 responding, and those over 40 years of age responding. And most of our respondents were female and came from the lower mainland BC. So what did we find? We asked a few main questions, which we'll go over until the results of. So one of the first questions we asked was, if you know someone who's struggling with alcohol use disorder, or if you're struggling with it yourself, did you access help? And what supports were accessed, if any? As you can see, 45% of people did not access help when needed. And then the other 55% visited a mixture of medical and mental health professionals, but some also commenting that it didn't work even when they went for help. One of the next questions we asked was, what was the most challenging part of addressing the alcohol use disorder? What were the barriers that made you not seek help for that 45% of people who did not go? And the three main themes that emerged were, number one, acknowledgement of the problem. So drinking is something that has become internalized to the Punjabi culture, and that's for a multitude of reasons, including the media, masculinity, and intergenerational trauma. And because it's so internalized as a normalized act in the community, it's difficult for people to recognize when their relationship with alcohol has become problematic. And often people felt that their drinking was quite normal. And whenever you brought up something in terms of addiction, they thought that was a conversation about drug use instead, and not alcohol intake. So it created a difficult environment for a person to identify an alcohol use disorder within themselves. Secondly, there was a huge conversation around shame. So due to the norms of the community, people didn't want other family members or families to know that they had a problem. And historically, this community has not had the privilege in discussing mental health and thereby understanding its nuances. So a way that this manifests, for example, is someone commenting that they just drink to release some of their stress, and then they're unable to see the link to mental health that has. And then there continued to be this shame around mental health and addiction, and that results in barriers to accessing resources and reaching out for help. Lastly, people commented on having a lack of culturally appropriate resources they could access. So people were trying to look for someone who could understand the person struggling, whether that was through having a counselor who spoke Punjabi, having a counselor who understood the culture, or not even knowing where to look at all and to begin this search. So one of the questions we also asked was, what types of resources would be desired to help with this problem? And as you can see, the answers are depicted on this table on the slide, and the percents written beside each option are the number of respondents who clicked on that as something they wanted. So 93% of people wanted Punjabi counselors, 78% of people wanted to know about medical clinics for addictions, educational information about emotional support for family, social supports, health information. So what we saw here was not only were there supports needed for the person struggling, but also for the family members who are supporting that person, and in terms of understanding and educational material. Lastly, we asked what would be the best way to access resource information. And the top three responses people had were to either use a website, social media, or phone apps, including WhatsApp. Taking all of this information and putting it together, we were able to create a resource. So this is called www.asranow.ca. Asra means support in Punjabi. This is an online bilingual platform to help Punjabi families navigate problems with alcohol. It contains everything from educational resources, explaining what addiction is, explaining ways to approach supporting someone with an alcohol use disorder. So that's discussing things like harm reduction, medical clinics, counseling, as well as there is a list of collated services from all throughout the BC's Lower Mainland that provide supports with a Punjabi lens. So whether that's Punjabi speaking counselors, Punjabi speaking clinics, we give all of that information of where that can be found here right now in BC's Lower Mainland. And the great thing about this website is it can be viewed entirely in English and entirely in Punjabi, depending on what the person needs. So in conclusion, as you can see, oh, sorry, I'm going to go back to the previous slide. And so what I also was going to say, since we created this website in February of 2020, we've had 4,470 page views, 1,372 visitors onto the page, and that's averaging about 15 visits per day. So it continues to be something that people are viewing. Obviously, we need to more intensely analyze what these numbers mean, but at this time we know that the resource is being used. So in conclusion, through this community needs assessment, we see that despite availability of resources for alcohol use disorder, they are inaccessible to Punjabi folk due to a lack of awareness and cultural barriers. Specifically, three large barriers are acknowledgement of the problem, shame within the community, and a lack of culturally aware resources. The community has identified technology as a viable tool to increase access to resources and provide community education. So the creating of www.ostarnow.ca has had a positive response so far, as exemplified in the number of views and people visiting the website. However, further research needs to be done to analyze the efficacy of the online website in order to understand if it's helping families. All of this is to say that marginalized groups with different sensitivities to alcohol use require a targeted and specialized approach to services. And hopefully thereby will decrease the mortality and morbidity associated with alcohol use disorder and increase accesses to resources. Thank you all for joining us for our research brief, or if there are any questions, please join us in the Zoom Q&A that will be happening later today. Thank you.